Executive Plastic Surgery, Bloomfield Hills, Michigan. So this is a nice patient, 54 years of age, with one set of implants from 2010 below the muscle. So she comes in, history of MS, and she wanted these out. She had the symptoms of breast implant illness, and she knew it was about time, 15 years that she had them. So as you'll see, she got 100% total capsulectomy, 115/26, initials kg. I cut out the excess skin on the right side. As you can see, full thickness to help with the contouring. The entirety of the implant capsule was removed completely, definitively. Relatively very thin capsule, as you will see. This was right on top of the rib, literally super glued to the rib. The entirety of the implant capsule all below the muscle. So the breast tissue above was not touched at all. And you can see a relatively thin capsule, a lot of inflammation as I dissected. And what is a relatively thick capsule, but certainly very transparent. You can see how thin this is. No matter how thin the capsule, we always assume that the implant is ruptured. There might be some fluid on the inside. As you will see, the entirety of this implant capsule has been removed. Now some fluid on the back, so if I go pick that up, you will see this leaching of this silicone, what is suggestive of Mentor 375cc intact implant from 15-16 years ago. Again, you will see how thin some areas of the capsular tissue are. The entire capsule has been indeed removed, and overall I'm very happy and content with how the whole dissection has gone. Some areas that are fatty tissue, that yellow, everything removed, so there is no second guessing the process. Now I'm going to go ahead and take my top sterile glove off. This is because I'm going to get a swab from this side. Just to give you an example, once I get done with the video, I'm going to do a culture swab very similar to this one. It's in a test tube, and I'm going to get some cultures from here, and then I'm going to put it in a container, and it's going to go to the hospital so that I'm going to get a good representative biofilm sample, if there is one there, to see if there is one. Now on the left side, you can see this incisional scar right here, contouring done. It was 5 centimeters from the nipple down to the crease on the right, and certainly on the left, to balance the two out. This is the con procedure. No lift. She certainly has done very well for someone 54 with 375cc implants. No drains. Clearly the blood loss was less than 5 cc's, which is the case in well over 99.5, 99.7% of the cases. Capsules are going to be sent to pathology. Cultures for microbiology, aerobic, anaerobic, and fungal. Very important, if you ask me, the high definition photos and pictures, not only of what you're seeing here, but the chest wall. That is by far the most important thing to show that the entire capsule was indeed removed. Implants will be returned to the patient. Basically deep sedation, twilight. The patient is going to be amnestic and not paralyzed, and the breathing machine not breathing for the patient, but essentially the patient literally breathing on her own, which is very effective and relatively safer, if you ask me. And then all patients, regardless, the same goal, so that there's no compromise in the capsule removal. And again, as you will see, the entirety of the implant capsule, this is the inflamed tissue. We'll have a look at it that I removed that was on the side. I did not like how it felt. And so as I cut this open, you will see, again, a relatively thin capsule, all done below the muscle. So the breast tissue, again, above the muscle was not touched. And as I pull this out, you will see, again, some fluid in the back, and I'm going to pick that up with my gloves, and you will see, look at this. This is what is slowly being, what is suggestive of and consistent, was suggestive of what is gel bleed, Mentor implant, 375 as well, intact implant. And then, just like we saw, this is the capsular tissue, relatively thin. You can see my green glove right here. The entirety of the implant capsule has been removed. with all good, healthy, viable tissue remaining behind, and the entire capsular tissue has been removed. So the implants will be returned to the patient. Again, going over the procedure itself, the capsules will be sent to pathology, cultures for Arabic, anaerobic, and fungal, high definition pictures and videos, and most importantly, no need for this unnecessary drain, because everything was removed that was bad. That's the capsule and that fatty tissue. Let's go ahead and look at this. This is this fatty tissue. I'm going to go ahead and cut through it. You will see it's not healthy. It is nodular. You can see the consistency of it. The pathologist is going to weigh in and see exactly what this is and what it is not. In the past, this has been read as inflamed tissue, fat necrosis, things like that, and we'll see what the pathologist says. So because all the bad tissue is removed, the capsular tissue is removed, the inflamed tissue around has been removed, all below the muscle. So there is no reason to put the drain in. The blood loss is minimal, and this essentially ensures that the entirety of the bad tissue is removed because the drains were not utilized. And so overall, we will see how the patient does clinically as well. Aesthetically, from a lift perspective, very important. Because of the implant that was gravitating the breast tissue down in this 54-year-old patient, between the recoil of the skin and the breast tissue, between the fluffing effect, now that there is no implant present in the proximity of the breast tissue is going to fluff out. Anytime you have an implant in the proximity of the breast tissue atrophies, decreases, diminishes. With the implant gone, it's going to get a chance to fluff out. You will see as the inflammation subsides, the tissue is going to recoil even more so. And then eventually when she does work out in 6 to 8 weeks, she gently starts. She will add 5, 10, 15% muscle mass to her chest, neck, back, shoulders, and you'll see that will also add not only function but aesthetic volume to her chest, which will a year and a half later be basically very pleasing compared to where she was with all this inflammation. So there you have it. This is Dr. Khan, Executive Plastic Surgeon.